Most people think a morning routine is about discipline. I want to show you why, after age 60, it's actually about survival. My name is Dr. Nathan Wells. I'm a board-certified internal medicine physician, and for over 2 decades I've worked almost exclusively with patients over 55, people managing blood pressure, blood sugar, heart disease, joint pain, and everything that comes with a body that has a few decades of mileage on it. I've read the charts, I've had the conversations, and I've watched the difference between patients who age well and patients who don't. And that difference almost always starts with what they do in the first hour of the day. Here's a number that stopped me when I first read it. A study published in the Journal of the American Geriatric Society found that adults over 65 who followed consistent morning behavioral patterns, specific things in a specific order, had a 32% lower risk of cardiovascular events over a 5-year follow-up period compared to those with irregular morning habits. 32%. That's not a supplement, that's not a prescription, that's a routine. What I want to give you today is the exact 7-step morning routine I recommend to my patients, the one grounded in the physiology of aging, not just general wellness advice. By the end of this video, you'll know what to do from the moment you open your eyes to the moment you sit down for breakfast, and more importantly, you'll understand why each step matters for a body over 60 specifically, because what works for a 35-year-old in the morning does not always translate to you, and I'll explain exactly where the differences lie. And step 4. I want you to pay attention to step 4, because it's the one my patients almost universally skip, and it's the one the Cleveland Clinic now calls one of the most protective habits a senior can build. Most people have never heard of it. If you've been watching this channel for a while, you know I don't ask this often. But if someone in your life is over 60 and they're not sleeping well, feeling foggy in the morning, or just dragging through their days, I want you to share this with them. Not because of the algorithm, because they need this information and their doctor probably hasn't had time to walk them through it. Before I go any further, I want to be clear about something. What I share here is education. It's meant to help you understand your own body better and have smarter conversations with your doctor. It is not a personal diagnosis, and it cannot replace the physician who knows your full history, your medications, and your specific conditions. Please keep that partnership with your own doctor. That relationship matters. Now, step 1, and this one starts before your feet touch the floor. The first thing I tell every patient who asks me about mornings is this: do not sit up fast. I know that sounds almost too simple to matter. But here's what's actually happening when you wake up after 65. During sleep, your autonomic nervous system, the part that controls your heart rate and blood pressure automatically, runs in a slower, quieter mode. Your blood pressure drops, your heart rate drops, your blood pools slightly in your legs because you've been horizontal for 7 or 8 hours. The moment you go from lying flat to sitting upright, your body has to redirect roughly a liter of blood from your lower body back up to your brain within seconds. When you're 30, that transition happens almost instantly. When you're 70, it takes longer, sometimes 5 to 10 seconds longer than you'd expect. And if you move faster than your cardiovascular system can compensate, your brain briefly underperfumes with blood. That's the dizziness. That's the lightheadedness. And in some cases, that's the fall. The CDC reports that 1 in 4 adults over 65 falls each year, and a significant percentage of those falls happen within the first 20 minutes of waking. The bedroom, not the staircase, is where most fall-related injuries begin. So the first step is deliberate transition. When you wake, lie still for 30 seconds, then roll to your side, push yourself up with your arms rather than your core, sit on the edge of the bed, and wait. Actually wait for 15 to 20 seconds before you stand. It feels slow. It protects you. Margaret, a 72-year-old patient of mine, had fallen twice in the span of 4 months, both times in the morning, both times blamed on just waking up too fast. After adding deliberate transition to her routine, she went 18 months without a single dizzy episode. One change. 18 months. Step 2 is water, and the amount matters more than you think. By the time you wake up, You've been without fluids for 7 to 9 hours. Your kidneys have been filtering and concentrating urine all night. Your blood is slightly more viscous, thicker, than it was when you fell asleep. Think of it like a garden hose left sitting in the sun. The water inside gets sluggish. It doesn't move as freely. That's your blood in the morning. For adults over 60, this matters because mild dehydration, not severe, not hospitalization level, just mild, raises blood pressure, slows cognitive function, and increases the likelihood of a blood clot. The NIH has published research showing that even a 1% drop in body water can measurably impair cognitive performance in older adults. Before coffee, before breakfast, before your phone, drink 16 ounces of water. That's 2 full glasses. Room temperature is fine. Cold water is fine. Just drink it first. Step 3, and this is where I lose some patients who resist it. Light exposure within the first 15 minutes of waking. Your circadian rhythm, the internal clock that governs your sleep cycle, your cortisol release, your metabolism, and your mood, is set by light. Specifically, it's reset every single morning by exposure to natural or bright artificial light hitting your retinas. This is not a wellness trend. This is a photoreceptor pathway called the suprachiasmatic nucleus circuit, and it runs like clockwork when it gets the signal it needs. When it doesn't get that signal, when you wake up and immediately go to a dim kitchen or sit in a dark room with your phone, the clock drifts. And in older adults, a drifting circadian clock is directly linked to disrupted sleep the following night, increased inflammation, higher cortisol at the wrong time of day, and greater risk of depression. Open your blinds. Step outside for 5 minutes. If you live somewhere overcast or cold, a 10,000 lux light therapy lamp works just as well. 5 minutes. That's the dose the research supports. Step 4, the one I mentioned at the top, is gentle movement before you do anything strenuous, and I want to explain exactly why this is different from just stretching. When you sleep, your joints lose some of the synovial fluid distribution they need. That's the lubricating fluid inside your joints, like the oil that keeps an engine from grinding. After 8 hours of stillness, that fluid has settled. Your cartilage, which has almost no direct blood supply and depends on movement to pull in nutrients, has been sitting without the compression and release cycle it needs. The muscles around your joints, especially your hips, knees, and ankles, have shortened slightly from disuse. If you wake up and immediately walk at full pace, climb stairs, or do a full workout, you're running a cold engine at highway speed. That's how you tear things. That's how chronic joint pain gets worse over years without a clear injury to blame. What the Cleveland Clinic recommends, and what I echo to every patient over 60, is 5 to 7 minutes of low-load joint cycling before any real exertion. Ankle circles while sitting on the bed, knee lifts while standing at the counter, shoulder rolls, hip circles, gentle wrist rotations. Nothing dramatic. The goal is to pump synovial fluid back through the joint space and signal the muscles to lengthen gradually before load is applied. Robert, a 68-year-old retired electrician I've treated for years, had been managing knee osteoarthritis with escalating medication for the better part of a decade. When I added this pre-movement sequence to his morning, his reported pain levels at his next quarterly visit dropped by nearly half, and we cut one of his anti-inflammatories entirely. He'd been skipping this step his whole life because no one had explained why it mattered. If you're finding this useful, and you have a friend or family member who's been dealing with morning joint stiffness or soreness, this is the step I'd tell you to share with them specifically. Step 5 is what you eat, and more importantly, what you eat first. I'm not going to give you a meal plan. What I want to tell you is about blood sugar, because the first meal of the day has an outsized effect on your glucose response for the rest of the day, a phenomenon researchers call the second meal effect, documented extensively in the Journal of Clinical Endocrinology and Metabolism. In short, what you eat at breakfast primes your insulin sensitivity for every meal that follows. A high-sugar, high-refined carbohydrate breakfast, even something that seems healthy like fruit juice, a bagel, or sweetened yogurt, spikes your blood glucose sharply, then drops it, then primes your body to be more reactive to glucose at lunch and dinner. Over time, that pattern degrades insulin sensitivity. For anyone over 60, this matters regardless of whether you've been diagnosed with diabetes, because insulin resistance accelerates cognitive decline, weight gain, and cardiovascular risk. What does the better breakfast look like? Protein first, at least 20 grams before anything else. Eggs, Greek yogurt with no added sugar, cottage cheese, smoked salmon if you enjoy it. Fiber alongside that protein, from vegetables or whole grains. Fat from something like nuts, avocado, or olive oil. The carbohydrates, if you eat them, come last. This isn't about restriction, it's about sequencing. The research on glucose control in aging adults is clear. Protein and fiber eaten before carbohydrates meaningfully blunt the blood sugar spike. That's a small change to the order of your plate with measurable consequences for your metabolic health all day long. Step 6 is medication timing, and I want you to take notes on this one if you're on any prescriptions. Most people take their medications whenever they remember, with breakfast, after breakfast, before coffee. For a significant number of common medications used by people over 60, timing is not arbitrary. It affects how well the medication works and whether you experience side effects. Blood pressure medications, for example. The American Heart Association has published guidance showing that for many classes of antihypertensives, taking them at night rather than in the morning provides better 24-hour blood pressure control and significantly reduces the risk of a morning cardiovascular event. Thyroid medications need to be taken on an empty stomach at least 30 minutes before food to absorb properly, and taking them with calcium, coffee, or certain supplements can slash absorption by up to 40%. Statins, cholesterol medications, are generally most effective taken in the evening because your liver produces the most cholesterol at night. But if yours is a morning statin, there's a reason your doctor prescribed it that way. I'm not telling you to change your medication schedule without talking to your doctor. What I'm telling you is, if you haven't specifically asked your doctor, when is the best time of day for me to take each of these, that is a question worth asking at your next appointment. It's a 5-minute conversation that can change how well your medications actually work. Step 7, and this is the one that ties everything together, is 2 minutes of intentional stillness. I want to be careful how I frame this, because I'm not talking about meditation in the way that word sometimes makes people roll their eyes. I'm talking about something physiological. Every morning, your cortisol, your body's primary stress hormone, spikes sharply within the first 20 to 30 minutes of waking. This is called the cortisol awakening response, and it's a normal, healthy thing. It gives you energy, sharpens your focus, gets you ready to face the day. But in adults who are under chronic stress, or who immediately flood their nervous system with news, social media, arguments, or a rushing schedule the moment they wake up, that cortisol spike overshoots. It stays elevated too long, and chronically elevated morning cortisol in adults over 60 is associated with higher blood pressure, impaired immune function, disrupted sleep the following night, and accelerated hippocampal shrinkage. That's the part of the brain most associated with memory. 2 minutes of sitting quietly, not with your phone, not with the news, before you engage with the demands of the day is enough to buffer that cortisol overshoot. Some of my patients pray. Some of them just sit with their coffee and look out the window. Some of them write down one sentence about what they're grateful for. The specific form doesn't matter. The absence of input is what matters. Your nervous system spent the night in its quietest state, and it needs a gentle on-ramp, not an immediate flood of information, to transition well. Helen, 76 years old, came to me 2 years ago convinced she was developing early memory problems. She was forgetting appointments, misplacing things constantly, feeling foggy until noon most days. We ran the workups. Nothing alarming showed up. What did show up, when I asked her about her mornings, was that she woke up and immediately turned on the news, checked her email, called her daughter, and rushed to take care of her husband, all before she'd had a single glass of water or 5 minutes of quiet. We restructured her morning with the steps I've described today, and we added 2 minutes of quiet before she picked up her phone. At her 6-month follow-up, the brain fog was gone. She told me she felt like herself again. She hadn't changed her diet significantly. She hadn't started a new medication. She'd changed her first hour. That's what I want you to take from this. These 7 steps, the deliberate transition out of bed, the water before anything else, the early light exposure, the joint warm-up before movement, the protein-first breakfast, the conversation about medication timing, and the 2 minutes of stillness. None of them require a gym membership or a prescription or a dramatic change to your life. What they require is intention. The first hour of your day is not just the first hour of your day. For a body over 60, it sets the neurological, cardiovascular, and metabolic tone for every hour that follows. Start with 1 step. Whichever one resonates most, pick that one, add it tomorrow morning, and give it 2 weeks before you add the next. That's how change sticks, not all at once, 1 step at a time, until the routine belongs to you. I'm Dr. Nathan Wells. Stay aware, stay proactive, and take care of yourself. I'll see you in the next one.